Dietitians are experts in nutrition and diet, and having been on the supplementary prescribing course or the non-medical prescribing course, we have done the same training as all of the other healthcare professionals who've gone through prescribing. We are the experts, we have the knowledge, and we have the skills.
As a recently qualified supplementary prescribing dietitian, I feel we should be trusted to independently prescribe.
Dietitians have a unique set of advisory skills, assessment skills, and in situations where there's a strong link between medication and nutrition, it's hard to see who would be better placed to independently prescribe. If you think of titration of medications like insulin or pancreatic enzyme replacement therapy, you do need that holistic knowledge, you do need all the skills the dietitians bring, and it just makes complete sense to me that it's the right way to do it.
We are experts in our clinical areas and have a really unique set of skills that it would fit really well with.
We've shown with supplementary prescribing that we are safe, we are effective and we are efficient, and ultimately we improve patient care by being prescribers.
They really are the only clinicians who can adapt and use all the nutritional information and encompass it to the prescribing plans. So it's that double aspect between food, nutrition and prescribing that nobody else can offer, that we can offer.
Because most of us prescribe within areas where we are seen as a specialist, we actually know more about some of these products or medication than actually the GP does. So feedback that I've had from GPs is, go ahead, you know more about this than I do, and we have the time to unpick that situation and often work out what's the best course of action. We really are in a place to actually be more helpful to the patient and also reduce the time that it takes other prescribers with less experience in these areas to see the patient instead.
We've been working with these drugs for years and years and years, alongside doing the dietitian advice, that if we can marry up the two, I think we are best placed in, not in every field, but a lot of fields where we are confident and experienced, we can be best placed to prescribe these drugs.
If there's any condition that food directly impacts, I believe dietitians are already placed with the skills to help with patients. Medication simply just fits into that, and dietitians should be able to just give the patients the absolute best care that they can give to them.
If we were independent prescribers, we're not going to suddenly start prescribing any different medications. They're still going to be the medications that are within our scope of practice, so the same ones that sit within that clinical management plan. So I believe we already act as independent prescribers and we're already trusted to, but we have a piece of paperwork that has to be done to allow us to do that.
Dietitians are really good at being trustworthy. They're a very conscientious profession, and I think in terms of prescribing it needs to be safe, and I think dietitians are very, very good at being safe and ensuring that they operate within the framework that they're allowed to and within the guidelines.